I'm RaeAnn, the Director of Community Health at St. Joseph's Area Health Services in Park Rapids. Our MBO was one of the first organizations to enter into the violence prevention programming through CHI. And through our community assessment, it became very clear that we had many areas that we could focus on, but the one common thread that seemed to go throughout it all was the aggression that seems to happen around relationships. And so that became our focus. We didn't know a lot about relational aggression, and so we had some things to learn. But from there, we set a priority around relational aggression and decided to look at what programming we could offer. And if I could give one tip of advice, I would say always move as much upstream as you possibly can in the field of prevention. And while we've focused on that baby being born into the family and understanding that both the mom and the dad need to learn how to nurture that infant, don't be afraid to go up that spectrum of prevention. And so that when they grow into this community, that the entire community has a culture around nonviolence.
My name is Cleo Hartung, and I am the Violence Prevention Coordinator from St. Joseph's Area Health Services in Park Rapids, Minnesota. And what we work with primarily, we looked at engaging fathers in our community, having them looking at other resources that we can offer fathers. And we wanted to have them be inclusive and engaged throughout all the systems that we have in our community and all the providers that are working with fathers to include them as well. We also are working with youth and a mentoring program and looking at a media literacy program that we teach youth to really examine the violence that's going on in screen time. We're also doing some home visiting, and we work with families from birth on to 3 years, and really looking at the families who struggle with education of being educated with violence or child development, looking a lot of what their socioeconomic status is looked upon, and the kids that are really on the verge of possibly living in homes where there is violence. So we go into the homes and provide a wonderful curriculum for them. The tip that I would suggest is, in the beginning phases, gathering your coalition, your community members, and looking at similar interests that you all have, and just bringing everybody together to see what you can do for your community, and keeping that strong, keeping those relationships strong throughout your grant process. Another tip I would probably have is looking at the evidence-based programming that is out there. There is a lot of research in the curriculums that are evidence-based, and we really took a really good look at that and are using that in our schools and in our community. So I'd really recommend that.